Hey guys, welcome back to Cell Talk. This is your host, Christian. I have Juliana here, and I also have our PA, William Joyce. Well, how's it going?
Pretty well. Thanks for having me on.
Yeah, thank you for coming. Yeah. So, we've already had some patients in today. You want to talk about kind of what we've seen, type of, maybe talk about type of treatments we've done today?
Yeah, so we've used stem cell and exosome in a variety of ways today, and it's what, 2 o'clock-ish, 3 o'clock?
Yep, almost
so, 2. We used exosomes with microneedling for hair treatment, which is really a great addition. In an hour or so, we're going to be using the same type of stem cells for the O shot. One of our clients has pretty bad urinary incontinence, and the O shot is a really good alternative for that. It's a great treatment. Yeah. So we'll be using exosomes there as well. We also did PRF injections for under eye.
What's PRF?
Yeah.
So we use PRF.
Yeah. So today, one of our clients came in and wanted to do under eye filler. I had previously done a consultation with her about 2 weeks ago, and I talked her into doing something more natural, like PRF. So platelet-rich fibrin is what that is. So you take the PRP and you activate it and turn it into PRF, and it becomes a more viscous, natural filler from the client's body. But we also added exosomes with that.
Nice.
Oh, wow.
Yeah. So you get the volume from the PRF, and then you get the longevity from the stem cell from a regenerative standpoint.
Wow.
Perfect. That's like that 2-piece in a biscuit.
Yeah. Yeah.
But yeah, and then our one this morning was a pretty big one with the stroke patient.
Oh yeah, that was our first of 4 every 30 days.
Yeah.
That protocol I basically made up based on previous stroke clients I worked with. She was all for it. So today was her first treatment. We'll see her again in 30 days. I mean, I have really good results with that protocol. And so what I would expect from her is a slow improvement with her cognition. Her speech is already pretty much returned from what her initial deficit was. Wow. But one of the keys when you're doing treatment with regenerative medicine is the sooner you treat to the time of the diagnosis, the better the outcomes typically are.
Really?
Yeah.
I didn't know that.
Yeah. So she was about a year.
Yeah.
Yeah.
Yeah. I mean, they told her she was going to be a vegetable too.
Yeah.
Or not, obviously they didn't say the word vegetable, but they told her it was going to be pretty bad. And she is pretty good, just high spirits and everything.
Yeah. And that tells you she's a good candidate as well, because
she can be receptive.
Yeah. So her neurologist in the hospital at the time of her stroke told her you'd probably need a feeding tube and maybe even a ventilator for the rest of your life. She said within about 3 weeks, she was nearly where she was when she walked in here, 2 or so weeks ago.
Wow.
So she already has natural recuperative powers. So someone like her getting treatment is really going to be the best outcome, period.
That's awesome.
Yeah.
Yeah. And like you said, for the people listening, if you have any issues, come the next day. Come the next day. Or day off. We'll see you. We'll see you there. But talk to us how you got into regenerative medicine. I know you've done work outside medical, so you can give us a little bit of background.
Yeah, so I've been in conventional medicine for 27 years. During that time, I've literally treated just about every discipline. But immediately prior to getting into regenerative medicine, I was doing addiction medicine, psychiatry, and recovery.
Okay.
I will tell you, after all those years, it's just a very tough discipline. I wasn't even sure if I was helping people or healing people.
Right.
And so just by chance, I saw this ad in the paper for stem cell because I was getting ready to leave mental health. I was pretty burnt out, quite frankly. So I answered this ad. I didn't even know what a stem cell was. I looked it up. I Googled it. I'm like, oh, man, that sounds cool. So, literally, right?
Yeah,
so I went for the interview. They hired me for some reason. And therefore, I started doing injections. So it was mostly orthopedics.
Okay.
But we did have clients that would come in, say, for a quarterly wellness IV.
Okay.
And by that, we basically mean exosome. So 5 cc, 10 cc, 20 cc every quarter, via IV, and these people were feeling very invigorated.
Okay.
There was one woman that had a low ejection fraction for her heart. It more than doubled in 2 months.
Wow.
And we weren't even treating her heart.
Right.
Yeah.
That's one of those cases where it's just something.
Yeah. The other thing too is stem cell and regenerative medicine is full of what I call surprises. And by that, I mean, we've had a client come in here several years ago. You know who I'm talking about. She came in for long COVID.
Yep.
So we treated her for long COVID, which was simply an IV using exosomes and mesenchymal stem cells. About 2 months later, she called up because, she is off, she's down in the Caribbean.
Yep.
So she called over. She asked for a renewal for her tremor medication. And I'm like, what tremor? Like, what are you talking about?
Yeah.
Because I'm not her primary.
Yep.
She came in for regenerative services. She's like, oh, yeah, I've had a tremor, since I was a teenager. And I'm like, well, how's that tremor now? Because I haven't been treating you. What's going on?
Probably didn't even notice it either.
She said, you know what? I don't think I have a tremor anymore.
Oh,
I'm like,
awesome.
well, I'm not going to give someone who no longer has a tremor a prescription.
medicine.
Why don't we give it another 2 months, 3 months? You're in and out of here on, for other services.
Yes.
I said, just let me know. So that was 3.5 years ago, post COVID long haulers. She still doesn't have a tremor.
Nope.
And we never treated her for a tremor.
Nope.
So like these are the things that regenerative medicine can and does do. Now, when we talk to clients, we don't tell them, hey, yeah, this is going to get fixed too.
Yeah.
There are clinics out there, a little unscrupulous, just for out for a buck. And they will say things like that to clients, like, oh, it'll fix that, it'll fix this, it'll cure. We're not here curing anything. We know the benefits of regenerative medicine. So that's what we are. We're part of the true believers.
Yeah.
And our clients, after one treatment, definitely 2 treatments, they become believers.
Yeah.
And we're not doing anything except for giving them stem cells or exosomes.
Right.
And we're not even treating diagnosis.
Correct.
And we're treating more symptoms as well. It
That's
just
correct.
happens that a lot of these symptoms are
Yeah.
due to diagnosis.
Yeah. Now, me being in conventional medicine for 27 years, if I see these 3 symptoms or I see these 6 symptoms, I mean, just from differential diagnosis, I can put a name on it if I cared to. But in regenerative medicine, we don't want to give false promises. We don't want to give false hope.
Yep.
So we talk to the clients about possibilities. We already know through research that stem cell therapy right now is what's called a novel treatment. So a lot more studies need to be done.
Right.
But when it comes to mesenchymal stem cells from the umbilical cord and placental-based exosomes, there is zero tumorigenic risk. So period. They're never going to turn into cancer. There's no issues with an autoimmune reaction because we do treat. We do actually talk to clients about autoimmune issues. So they don't attack these cells because they're considered immune privileged.
Right.
And during that immune privilege, they're not even seen as foreign in the body. So all that coupled with the longevity that we get out of it, I mean, our clients are just really getting a huge improvement in their well-being.
Exactly.
Awesome.
And our success rate is around 90-ish.
Yeah.
'Cause not everybody responds. Not that they respond bad. Not everybody sees.
Yeah.
I mean, I think that's why we are very honest, and that's something. Yeah, you're very big on telling patients the truth that it might work.
Yeah.
There's also a possibility it might not, but there's never going to be a negative effect of where your treatment is.
And to that point, back when we first started, we weren't even doing real advertising. It was long before Cell Talk.
Yeah.
And I was pretty amazed, like, as the clinician here, because I've been here since the doors opened, that we were even getting all these clients.
Yeah.
There was no advertising, no Google ads, nothing on Meta.
Yeah.
And
early adopters.
okay, well, we got 3 people coming in tomorrow. Oh, I've got 6 people coming. I'm like, how?
Yeah. Where?
Well, because we
Helped somebody.
They told
Word
their
of
friends. Yeah, we did have a a client that actually, he was a tattoo artist.
Yes.
And for a long time, obviously, right? Not a beginner. Mm-hmm. And so his profession required him to be, somewhat hunched over or in uncomfortable positions for long periods of time.
Oh, I remember him.
Yes. And so he came in because he was ready to retire or quit and get another job because the pain in his neck, he couldn't get through a 2-hour session.
Yeah.
And so when clients come in, they need 10 hours, they need 8 hours, they need 11 hours, he would be crying in the chair. So a friend of his told us, about this, and he came in. I did the one treatment where I just did injections in his cervical spine. He hasn't stopped telling people
about
since,
it.
and he never came in for a second treatment.
Wow.
Yeah.
And that was 5 years ago.
That one initial.
One initial.
Incredible.
Yeah. And again, so that's an orthopedic example of the power of regenerative medicine.
Yeah.
And then there's also like the general wellness, like IV infusions quarterly, that it's only a benefit as well.
True.
Give us a little more insight, maybe like the scientific difference between exosomes and stem cells.
So.
And make it so some people understand too.
Yeah. So it's
for dummies.
I can make it pretty simple because it
is pretty.
Yeah, they travel together.
Yeah.
Right? Because the exosomes, which are these nanoparticles released by the mesenchymal stem cell, are already in a mesenchymal stem cell. So when we order cells based on my interview or consultation with the client, I go through their entire history, look at their medication history, and if there's any kind of orthopedic issue, I've looked at their MRIs or studies.
Yep.
Once I base what my recommendation would be, obviously it always starts with mesenchymal stem cells, but in about the last 2 years, once I started adding additional exosomes to the mesenchymal stem cells that I had been using, my whole career, the outcomes just got so much better, right?
Sure.
And so back to what's the difference? Mesenchymal stem cells produce and release these nanoparticles that they carry called exosomes. And really what you want to think of is the exosome is the secret sauce.
It's like a supercharger.
Yeah, of the regenerative properties of what a stem cell does. Now, you don't get exosomes without a stem cell and vice versa. But think of initially what happens are these nanoparticles are so tiny that they will cross the blood-brain barrier. So we know that they're getting into the central nervous system.
Yeah.
They're in the brain. They're in
literally
everywhere.
Spinal cord everywhere.
So when you're discussing with somebody that comes in, say with neuropathy, right, from whatever the case, well, if you're using exosomes, and even if you're using mesenchymal stem cell because you're going to get exosomes, those exosomes are going to be what start the regenerative properties first. And then think of the mesenchymal stem cell as the more long-term regenerative, power, because what they do, they are going to replicate every 28 hours or so, and every time they do, they release more nanoparticles called exosomes. Exosomes actually carry the cytokines for signaling, through the paracrine system. They have all the proteins, the growth factors, and most importantly with exosomes, they have the anti-inflammatory ability. So when clients come in for a service and they call us 3, 5, 6 days later and say, I'm golfing again. That's the exosomes.
Got it.
Because it made them comfortable. It improved their quality of life relatively quickly. But additionally, the mesenchymal stem cells are going to keep going. Yeah.
Sounds like they're like a little bit of a catalyst.
Correct.
Kind of.
You need one to get the other. Yeah. But
it's like sales and marketing. That's my brain. I'm like, sales, you need sales. Well, sales is first.
Yeah. And because of their safety, it's all we use. I personally have never given someone cancer, and by the time I die, I want to be able to say I've never given somebody cancer.
Right.
And that's just not what we do. There are safe alternatives in regenerative medicine, and there are more risky ones. Well, if you want risky stem cell, go to Mexico. Because you don't need to leave the country.
No.
But if you don't want safe mesenchymal
I've heard
stem cells.
so many people say they need to leave the country.
No,
I'm gonna go over here.
my aunt, we talked about this, for some scarring. And she told her provider, I guess a surgeon, that she got stem cells, or I think she asked, are stem cells, will this be okay if I use them? And he was like, yeah, I mean, that'd be great if you could find them in the country,
in
and
the
she's
United
like,
States, right?
Yeah, and she's like, well, I know somebody in my immediate family.
Yeah.
It's like. Yeah. It's like, okay, it's crazy to think. I mean, that guy's in Pittsburgh. He's obviously not in Florida. But it's crazy to think that even medical professionals are still unknowing.
It's true. Even when, we don't typically get referrals from conventional providers because those conventional providers are still wearing their blinders. They did not teach me anything about stem cells or regenerative medicine. These words were never spoken until I saw the ad in the paper.
Yep.
Yeah.
And then when I went there, by the grace of Google, I knew for the interview what it was. But I still had I didn't have a handle on it really at all. So I learned on the job. I went to obviously several seminars. I read experts' books.
Yep.
And 8 years later, I'm considered a specialist or an expert as well.
Yeah, and I mean, in as time comes, protocols are changing.
Yep.
They're coming out with new products.
Yeah.
Just the level of science behind it is increasing, and Ivy League schools
it improves.
Yeah.
Yeah. Literally monthly.
Yeah, it does. There's always something new each month coming out, and the labs we work with are very good at keeping on it and being on their studies and everything. Like Harvard, Stanford, those Ivy League schools are doing studies nonstop. Yeah. Anytime you look up stem cells, I always see Harvard is like number one.
Researcher. Many of, and this has been for several years now, many of the large, universities are and have been studying. Many have clinical trials with humans, right? So that, more of those need to be done, but every month, every day, every year, more and more are being done. And obviously we're learning because we, in this line of work, we would love to see a novel treatment such as regenerative medicine that we see the results to be able to be, for the masses.
Made to
this needs to be public.
Yeah.
I mean, I have seen, I think it was on ABC News or Good Morning America. It was either Neo, one of the pop artists was getting stem cells, but it wasn't how they were getting the stem cells extracted to give to another person.
Okay.
Now how we use stem cells, our stem cells are not, they don't have a DNA. They're not
right.
The stem cells that we're getting are not biologically domained to another person. Right, so it's not.
Yeah, so they have messenger RNA, and RNA, as you know, is even more crafty than DNA, whereas it can turn literally into many other things. But they haven't been activated because the labs that we use, they harvested those cells post live birth. The secret is live birth. So once the baby is already living its best life, now we have this. Medical waste, if you will, that the mother chose voluntarily without being paid to donate.
Would have otherwise been discarded.
Correct.
Yeah.
It happens a lot of times.
So that's one of the ironic beauties of regenerative medicine.
Yeah.
Think about it. It's medical waste that is helping people.
Yeah. It's incredible.
Yeah.
And it's very simple. I mean, I know there are people out there that keep the placenta and go back towards it. I don't know how long that would last for.
Yeah, they consume it. Yeah. Many people will consume it.
Kim Kardashian, I think,
for
did
the
that,
properties.
Right? Yeah, she did that.
I
She had her placenta. It sounds a little nasty.
I think it was.
You can get it capsule form.
Oh,
you can get them to make it capsules.
Yeah, so I know.
You have to eat it like a steak.
Yeah, so I know.
Cook it on the Blackstone.
Please, I don't think they'll give it to you.
So I know colleagues that have roasted it and eaten it, but I've also known colleagues that do what you did. They had it dehydrated and put into capsules.
No, are you still getting the stem cell benefits from that? Because I didn't know if it had, because I wasn't sure if it had to be frozen and thawed, or I wasn't like if you cook it, will it take away?
It does need to be frozen because so think about it this way, right? If you and your significant other had a baby, you're not like, all right, you get a babysitter. We've got to eat this placenta in a couple hours. Right? So it's frozen, and they know the value of it, and they believe in that value. So it's going to be frozen. They're going to get around to it once everything's kind of settled in their life.
Once your appetite's back,
they'll actually do what's called a ceremony.
Hey, we might be doing that. one day.
Yep.
That's hilarious. Someone opens your freezer, placentas right in the fridge.
Yeah.
That's hilarious. For me, would you?
Yeah, can we pull out the thaw? We got to chuck a roast.
Can we talk a little bit about the topicals? Because I was super impressed with one of our reps. She was talking about it. I was kind of trying to listen, but she was talking about a topical that she carries with her, and I thought that was cool because they put stem cell in face products now too.
Yeah.
I've seen
they're putting, so from an FDA standpoint, many of the products that are out are approved for only topical use.
Okay.
Because the FDA is pretty conservative.
Yeah.
And not all the knowledge
Right.
or satisfactory studies are present yet.
Right.
So it's very safe to use stem cells and exosomes topically. Again, like I said this morning, the person who I did the PRF with, that was topical.
Right.
The gentleman before that, I'm not even sure if I mentioned it, but we did microneedling with exosomes for hair regrowth. This was his second of 3 treatments, and he's already seen, some hair growth. Even though really the expectation is 6 months down the road, then you'll really be seeing the regrowth. But the topicals have really taken off from an aesthetic standpoint. So I've been doing this from a scientific standpoint, orthopedics, autoimmune. So I've been looking at it from a medical side.
Sure.
But since I own an aesthetic practice and am, in multiple aesthetic groups, with other colleagues, I will tell you in the last year and a half, everyone's talking about exosomes. I used to be the only guy in groups of thousands. Like people would see me at, CME conferences here and there, and they would come up to me, "Oh yeah, you're Will, right? You're the stem cell guy." I'm like, "Yeah.
I'm that guy."
Yeah, I'm that guy.
I'm that guy.
So I started like on my my Instagram, going back, I started doing topicals as well, but I was already doing injectables and doing IVs as well. So I had a much bigger head start than my colleagues in the aesthetic field, but I will tell you, hardly anyone isn't using topical. So I don't do laser, laser treatments for skin at my aesthetic practice, but those that do, they're using exosomes post-treatment. So for healing properties, topical.
Yeah.
So whereas before you would go through a laser treatment or a microneedling treatment and have to take off work for 3 to 6 days, with the topical put on directly after the treatment, everything's good in about 2 days. Cool. So the amazing, the healative process of that is really impressive.
Cool.
Yeah.
That's kind of what I'm trying to get with my aunt, but more of a spray with the saline and stem cells as well. Yeah.
So what I use for scar reduction, it used to be, you put in, steroid, like cortisone or something, and you'd have repeated treatments. And, marginally, I guess it worked-ish, but it wasn't gone.
No.
Right? So about a year and a half ago, I started, because I have these clients that, let's say they've already gotten breast augmentation or they've already had a surgical Brazilian butt lift, right? Well, scars are left.
Yeah.
Regardless of what your intention was when you, chose to have these cosmetic procedures, they're scarring.
Right.
So I would see these clients for regenerative things that we were doing here for them. And I started pointing out like, well, I can treat that, or there's a good chance I can reduce those scars. And even with keloids and people that are susceptible to keloids, it also works in something that severe because it's scar tissue, right? So I no longer, use a steroid injectable, and that stings, by the way. I'm using strictly a combination of exosomes and microneedling and mesenchymal stem cells. And the same scar that used to take me a year and a half is pretty much gone in about 3 months.
Wow.
Cool.
Yeah.
Wow.
I love it.
Especially for people that can develop keloids, that's definitely a big thing.
Oh, that's huge.
Yeah, that's definitely a big thing because any little nick or anything like that,
and someone that has a history of keloids, they can be debilitating. Not from a disability, but to the person.
Yes, psychologically.
Psychologically, it's a real impediment to quality of life. So when you're able to offer that to them and give them hope, but also show them that it's more than doable. It's actually happening, and you don't have to leave the country to get it. Yeah, you're making a lot of people happy.
Yeah.
Oh,
Yeah.
It's incredible.
What I mean, there's a Rolodex of treatments that you've done. What would you say was probably one of your most fun treatments, or some you're like, wow, that was kind of surprising that we were able to treat that, or something like along those lines?
Well, to your latter, question where I was, that was really cool that we were able to treat that. Here at a Palm Beach Stem Cell, we worked with an autistic boy, and so his parents brought him.
I was hoping you were going to talk about this
for
one.
a number of days. Obviously, this is foreign to him. We're foreign to him, so they were able to pick the day that worked best for him.
And he was about 4 years.
He was 7.
7, okay.
Yeah, so he even brought in his own phlebotomist nurse that knows him and he's okay with. Because there's a lot of factors, right? And
Absolutely.
we're all strangers. So he did relatively well, even though it was a challenge giving him, starting his IV. And he was supposed to have 3 treatments. That's what my recommendation was initially, and then see how he does, go up to about a 6-month period and let us know, because if he's improving and we don't know who stem cell is going to work on or not,
right.
I would say do 3 more. So they were on board. It turns out they weren't able to come back or chose not to come back, but they have talked to us since then because they're clients here. And they said his behavior and his attention span is so much more improved with only 1 IV of a 3 IV recommendation.
Wow.
So that was probably the one that stands out to me the most, like, wow.
Yeah.
Look at we just did. Right?
Yeah. It's
Another
not an
one.
injury.
No. And another one from the stem cell surprise category. I did another gentleman about 6 years ago. He was obese, had a bad back like most people on earth. And so I did orthopedic injections in his lumbar spine. So I did the lumbar spine. I had him come back, for a 1 month and then a 2-month follow-up. He was doing great. So the spine was fine. He wasn't complaining about back pain anymore, which that's the whole purpose. That's the win right there. So that he came back for his second 2-month follow-up, and he's like, "Hey doc," now I'm not a doc, I'm a PA, but he calls me doc, and he's like, "Hey doc, I gotta hand it to you. I haven't felt my feet in 10 years." He goes, "Thanks a lot."
Wow.
I'm like, "What the heck are you talking about?"
Yeah.
Like, what are we talking about?
Yeah,
feet. I said, "Harry,
like,
I didn't do your feet."
Yeah.
Yeah. He's like, "I've been a diabetic all my life." And he said, "I haven't felt my feet in 10 years. He said, "Last weekend, I stumped my toe. I cursed you at first, and then I thanked you."
Wow.
So
That's a crazy
awesome.
one.
yeah, it's funny how these things happen. Like I may tell a story with a client, not to give them hope, but to let them know that things may happen.
Yep.
Only good things, like stem cells and mesenchymal stem cells and exosomes, never have caused
Adverse reaction.
bad things,
Right.
period. So I tell them things that may occur or that have occurred. Now, I'm not telling them it's going to occur, but I want to let them know that there's a lot more that stem cells can do because I'm not programming them and we're not programming them. And because we are in the United States, the FDA doesn't allow us to program them. So when you're getting treatment in the United States, they're the most pure mesenchymal stem cells. They're unadulterated and they're unprocessed.
Right. That's crazy. I mean, we've kind of heard, I think one was even from an ND. He got an infusion. I don't know if he got orthopedic injections, but with the infusion, he noticed that his vision was better.
Yeah. See?
Yeah.
Stem cell surprise.
Yeah. I mean, and you really don't know unless you feel where that inflammation is.
Yeah.
We don't know exactly where the inflammation is in your body. You don't know what it's going to hit.
Yeah, and it's typical. Like if I'm doing a systemic treatment, say autoimmune or something like that, I've already talked to the client about all the possibilities and expectations, and it's very typical. Actually, it happened this morning with the stroke client, where they'll bring up orthopedic issues that we didn't previously talk about, and I have arthritis all over the place. You think it'll help? And I say help is the best word that you can use.
Yes.
Yeah.
because stem cells go where they're needed.
Yeah.
Yep.
Again, they're not programmed. Mother Nature has programmed these.
Right.
So when they're in the new host body, which is called an allographic tissue transplant, those cells and those exosomes will do what they want to do. And what they want to do is regenerate and hone in on inflammation.
Right.
And just by virtue of having a chronic disease or an injury, whether it's acute or chronic, you're inflamed.
Oh, yeah.
You're chronically inflamed.
Yeah, I mean, we're all inflamed in here. I can tell you that right now after the lunch we just had.
Oh, well, yeah. That'll do it to you.
Yeah, that'll do it too. No, it really is crazy how like many different symptoms these can treat. And I mean, just the Rolodex is endless. It really is. It's up to the patient. You kind of have to follow a protocol for after as well. Kind of limit the alcohol.
Yeah.
Kind of want to limit the activity for a little bit. But say you come in for a knee surgery, you're not worried about 9 months of rehab.
Exactly.
You got 30 to 60 days.
30 to 60.
Yeah. I've followed that. I mean, that's a chunk.
So another interesting case is I had a client who was at the beach, stepped off of his boat, ruptured his quad. So the distal quad just rolled up, right? So he was a surgical candidate, period.
Yeah, absolutely.
So he went and got his surgery because he had to have surgery. And about 2 weeks afterwards, he hadn't started PT and wasn't going to for about 12 weeks. So I treated where the incision was with a combo of mesenchymal stem cells and exosomes. And by the time 12 weeks later, he went to PT. He wasn't wearing a brace anymore, didn't need a walker, stopped his crutches, all prematurely, according to his doctor's plan.
Wow.
And when he showed up for physical therapy, he sat down. The therapist did her evaluation, and she's like, why are you here? He's like, I had surgery 12 weeks ago. And she says,
I'm here for my PT.
What else did you do? Oh, well, I did stem cells and exosomes.
Wow.
And she's like, keep doing that.
Yeah.
Once they see the results, I think it's once they see the results, and I feel like they're kind of on the. I mean, that's like a true hater.
Yeah.
But it's kind of like I feel like for some other medical professionals that they're kind of on the fence or they just don't really know too much, and then they actually see the results firsthand. Kind of is an eye-opening thing.
Yeah.
I mean, so many of medical doctors try to leave their profession to get in it as well.
Well, so we have plenty of clients that have orthopedic issues here, right? So when I look at their MRIs, because of my 27 years experience in medicine, if someone needs surgery and I know the stem cells aren't going to repair it, they are surgical candidates, and that is what they must follow. And I tell them the same thing. Go and get your surgery. You have two options that we can help you with. So you can either come in for like a week to two before your surgery. You can do exosome IVs to help with upcoming inflammation, your current situation that needs surgery, and start that recuperative process before you even have the surgery. And then post-surgery, it makes the healing process so much shorter and quicker because your body is already infused with brand new exosomes.
It's fighting already.
Yeah. And if we happen to miss them and they already had surgery and they come in, then we do it post-surgery.
Yeah. The quicker post-surgery, the better. Though.
Yeah, exactly. The closer you can. Yeah.
Yeah.
Cool.
Yeah. It's crazy. It really is crazy. Is there anything that you would like down the road you would like to treat? Is there anything that you're like, once we can do something that you're like, okay, that's why I would like to help that?
Yeah. So worldwide, but in the United States, for the purpose of this conversation, diabetes. Diabetes is so, it's almost pandemic here. Part of it is the diet. Besides type 1 diabetes, which is largely genetic, type 2 diabetes is nearly all reducible by just lifestyle. But this is the American diet. This is the American
McDonald's,
way.
Chick-fil-A.
Yeah, we're surrounded. Well, we're busy people. We're a busy
Everybody's
nation.
On the move.
You got to get going quick. You grab this, you grab that. It's supposed to be health food. It's really
your
not
Starbucks is 1,500 calories.
And I was talking to him, I think last podcast or two podcasts ago. Even the healthy food here in America, quality is
not healthy.
terrible. When you think you're eating healthy, I went and looked at Pura Vida menu. I'm thinking I'm having a salad. It's 1,600 calories.
Yes.
Yeah. Where?
Well, they have to make it. They have to make it taste good.
Sure, but people don't know that.
Yeah, our taste expectations growing up in America are ridiculously skewed.
Crazy.
Like an apple already has flavor. You don't need peanut butter on it.
No.
You don't need to put sugar on it or a chocolate syrup or honey.
I do enjoy some honey on my yogurt.
It's not that it's not going to happen, but if you were a good diabetic and it's so hard to be a good diabetic, you shouldn't be putting
100%
honey on your apples, right?
I've seen plenty of diabetics kill a pint of Ben and Jerry's.
Yeah.
I mean, I could too.
Yeah. When I talk to diabetic clients, conventionally, I've always said, okay, so are you the buffet kind of diabetic or the non-buffet? Of course, they actually tell me that they're the buffet. They're like, because it's America.
Yeah.
When you can eat
large amounts.
Large amounts and
for $10,
3 for leftovers and
Still.
put some in your purse and take them with you.
Why not?
It's hard to not do that.
When the price of everything else is so high, you're like, I'm going to take advantage. I'm going to take advantage.
Who can say no to a dessert bar, right?
No, I mean, my fiance and I are planning a wedding, and we added in ice cream bar.
Wow.
We added in the ice cream bar.
Yeah.
There you go. I'm just contributing to the
most
problem.
excited for that, not the wedding. No. I think, there's some other things that help with the diabetes as well. Semaglutide, trisepatide being one as well.
Yeah.
Can kind of hone that in. And stuff people don't really talk about.
With both of those GLP-1 inhibitors, they are finding, again, remember we said science is expanding like weekly, monthly, daily. Originally, that was a type 1 diabetes. So Ozempic was originally approved by the FDA for type 1 diabetes with obesity. So you had to have both or your insurance isn't paying for it. And therefore it wasn't in reach for a lot of people. Then they realized, because I had been using Ozempic in years in pediatric obesity, with or without diabetes. It's a approved diet drug for children. Yeah. So why can't adults have it? I had no idea. But anyway, now that is all improved. Yep. And now it works for research shows that it's promising, working for Alzheimer's, early dementia, heart attack and stroke, cholesterol. So if you, from a medical standpoint, when I think of what diabetes is and does to your body, it all makes sense. Well, if you're going to lose weight, losing weight is the number one thing that brings down high blood pressure, brings down type 2 diabetes. Yeah. So of course it's going to improve everything else. Yeah. Right. So let people have it. Yeah. Yeah. There's no reason to restrict drugs that work.
No. I mean, I know so many things get pulled off the pharmacy here and there. Like BPC got yanked for God knows why. I mean, because it helped people probably. And it's like
that is the only thing I can think of.
Yeah. Yeah. I mean, so many. I mean, I know they're probably going to try to pull trisepatide off.
Thus far they've tried and have succeeded for at least during periods of time to pull everything off the market that we use in a regenerative anti-aging standpoint. It's common in medicine, conventional or otherwise, that you use medications that are off-label. Right. So, okay, I mean, think of aesthetics, right? If a certain filler is approved for your cheeks, but it also does great lips, are you not ever going to do the lips? Right. If there's a safety, if there's no safety issue, of course you're going to use it. So that's considered off-label. It's the same thing that happens with prescriptions. It's the same thing that happens with, say, as an Ozempic, but a peptide. Well, what did this peptide do to you? Why did you pull it off the market?
Nothing. Only benefited.
No answers. Yeah. No answers whatsoever.
Yeah. I mean, they yank them off left and right. I mean, all the growth hormone peptides, they pull those.
And who suffers for that are the clients.
Oh yeah.
Because they come to a specialty like us. Yeah. We know what we're talking about. We take a thorough history, blood work.
Full panel.
I know physically what's going on in every one of our clients. Yeah. So if I decide this peptide I think is going to be beneficial, this peptide may be beneficial, who's stopping it? Like, I didn't stop it. Right. So now my client's been on it for 2 or 3 months. Now it's no longer available. So any progress that they've made, and these are measurable progress. What did they do?
It makes people want to get off like the black market.
Exactly.
And then it's like, You don't know. Someone's making this in their bathtub. You don't know.
Well, a lot of peptides are from Asia and even Canada.
Yeah.
Now, if you had a choice,
Canada.
it probably is Canada, but either way, do you really want to buy something that's not from your local compounding, pharmacy that you trust?
Yeah. I'd rather.
And you shouldn't have to make those decisions.
No, you really shouldn't. It really shouldn't. I mean, if it helps, why not? But I think it goes back to the talk of us talking about like food. Yeah. Like how food is killing males' natural test.
Yeah.
Killing. I mean, females need test. Yeah. Testosterone levels as well.
Even hormones.
Yeah. I mean. Birth control, things like that.
The things they allow compared to what they pull off is just it blows my mind.
Exactly.
It's all toxic. I mean, everything, food, cleaning products, like
chemo,
everything. Yeah. Oh, don't.
Oh yeah.
Chemo.
Yeah. Let's leave that.
There you go.
Yeah, let's leave that at that. Yeah. We'll leave that at that. But.
Mic drop.
Yeah. Right. I mean, anything else you think you guys want to add? Anything we missed? I don't think so.
I think
we covered a lot.
Yeah, we covered a lot of stuff. I mean, if you guys come out, I mean, after this, if you have additional questions, I mean, you know where to
always
find
come
me.
Back on.
Yeah, I can always make a second appearance.
Yeah, absolutely, absolutely. Well, I'll let you tell the viewers what your Instagram is, where your business is, stuff. So promote yourself.
Awesome. Yeah, so you can find me on IG at Aesthetically William Francis, and I'll see you then.
Boom. Boom. Juliana, you can find her here at Palm Beach Stem Cell. You find me here at Palm Beach Stem Cell. Our phone number for Palm Beach Stem Cell is 561-532-7743. And the email for that is info@pbstemcell.com. My cell phone number is 561-650-4183. And my email is christian@palmbeachstemcell.com. Well, thank you, Will. That was fun. We got a lot of great information. We'll definitely have to have you back on.
Yeah, thank you, guys. I appreciate it.
Yeah, all right.
Like, comment, and subscribe.
Yep. There you go.
Thanks.